Today we're talking about how to recover from a concussion in 10 steps. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips for living with concussion management so that we can all benefit in our own personal journey to better health. What does it mean to have a concussion? A concussion is a brain injury that happens when there is a shaking of the head or shoulders, or acceleration, deceleration of the head, like during a car accident, or a blow to the head, like after a fall or sports injury. Sometimes the concussion can be so severe that you pass out. Sometimes you may just feel slightly dazed. Signs and symptoms of a concussion may be immediate or mildly progressive. Common symptoms include headache, nausea and or vomiting, dizziness, tinnitus or ringing or buzzing in the ears, blurred vision, drowsiness, brain fog, memory loss, difficulty concentrating, light and or noise sensitivity, difficulty sleeping. A severe brain injury can include the following signs and symptoms: one eye pupil bigger than another, headaches that keep getting worse, seizure, difficulty staying awake, inability to recognize people or places and or increasing confusion, weakness or numbness in the arms or legs, slurred speech, repeated vomiting, or a change in personality. These signs mean you need to go to the hospital emergency room immediately. A concussion can be a serious thing. This is your brain after all. It is highly advisable that you see your doctor to check your most valuable asset. Your doctor can then direct you to other licensed healthcare professionals that can help you recover faster. A physiotherapist can help you with your dizziness, pain, neck mobility, muscle tension, joint stiffness, and balance. An occupational therapist can help you with your memory, focus, word recall, and returning you to your activities of daily living and work. A social worker or cognitive behavioral therapist can help you with stress and anxiety management, as well as to help to connect you with any community resources, financial, job, school, or family assistance you may need while you recover. Also, it is extremely risky to return to sports after a blow to the head. Even if you aren't experiencing concussion symptoms, you need to stop and take some days off to see if any symptoms develop. Another concussion, while still recovering from a first concussion, can lead to serious consequences and be fatal. If concussion symptoms last longer than 3 months, then the condition starts being referred to as post-concussive syndrome. I know you're wondering, how long should it take to get better? When will I feel normal again? And there really isn't a simple answer. About 90% of concussion symptoms improve or disappear within 2 weeks. However, our brain is complex and no two people have the same brain. It depends what normal is. For example, how much responsibility do you have in your normal life? Are you a caretaker? Do you have a demanding job? Are you a student studying for exams? How much peace and quiet do you realistically have? How much stress are you under? How is your physical health? How old are you? How many concussions have you had? So you see, there's no simple answer because brains are not simple. What we do know is that most concussions will heal, especially if you take care of your symptoms early on. But even if you've had symptoms for years, the brain is a wonderful thing because of neuroplasticity. Neuroplasticity is the brain's capacity to change. But let's be real, adaptive changes in your brain, for better or worse, requires frequent repetition. Meaning, the more you do or think something, the better your brain gets at automating the process. As a simple example, you can train your brain to remember someone's name by saying it out loud frequently and associating a picture with their name and face. An example of a bad way that the brain adapts is by getting into the unshakable habit of gorging on chips and ice cream on the couch every night you watch TV. I know it seems like I'm getting off topic, but the point is that it's never too late to change your brain. Unless we're talking about degenerative brain conditions like dementia or Alzheimer's, that's a whole different issue. We'll talk about the brain's amazing capacity to change later on. Another factor to consider when asking how long it takes to recover from a concussion is the fact that our bodies don't do anything in a completely linear fashion. Think about weight loss. You could be following some diet to a T and lose different amounts of weight or no weight or even gain weight at each week. We grow taller in spurts, and it's no different when it comes to the body healing. Some days will be better than others, but the overall trend will be positive. What should we do after a concussion? We first want to minimize bad stimulation to the brain and encourage good brain stimulation. What does that look like? Well, try to rest for the first week after your concussion in a quiet, dark space. Avoid reading, working, socializing, or being in crowds, driving, music, bright fluorescent lights, or strong sunlight, and strong smells. Reduce your screen time significantly. There are a number of reasons as to why you need to stop using your phone or computer at the beginning after a concussion. Nowadays, we rarely just look at one thing at a time. We have multiple windows open on your computer, numerous apps open on our smartphone, and oh yes, we're also watching a video or show at the same time or have music going on in the background. And normally you may feel that you can handle that, but really your brain is not fully processing all that information at the best of times. So imagine now that your brain is trying to recover from an injury, but you're still scrolling through social media and texting all day. It's just too much right now, and the energy your brain needs to heal is being directed to processing the latest videos. Another reason why you need to stop using your devices when you're trying to recover from a concussion is that the blue light can really worsen that sense of dizziness, blurred vision, and pain behind the eyes. Obviously, not everyone can completely abstain from using a computer while they're recovering, so it can really help to buy some blue light blocking glasses to use during your screen time. While you're at it, consider getting an anti-glare shield for your main laptop or computer. Change the settings on all your devices to stay on the warmer nighttime mode. Also, increase your font size so that you don't have to strain your eyes to focus. Use a timeout Chrome extension or other app that will alert you at scheduled times to remind you to take screen breaks. Practice good posture. A concussion is caused by some form of fast deceleration or jolt to the head and neck, so it makes sense that you likely have some injuries to your neck, muscles, and spine too. During your healing time, think about being mindful of sitting up straight and keeping your head back so that your ears are over your shoulders. The further your chin pokes out forwards or your head is bent downwards, the more pressure you put on your neck and spine. Most people typically look down at their phones that are at waist level. That's about 60 pounds of extra pressure on your injured spine and shoulders. That's why you feel exhausted and your muscles feel tight and sore. Instead, practice your chin tucks while you glide your head backwards, like a drawer that is being closed shut. And just like a drawer, your head needs to be level to glide properly in its tracks. Of course, we can't always have a Buckingham guard straight ramrod posture. That wouldn't be comfortable either. What you also need to do to promote the best healing of your neck is to frequently move your head in all directions as far as it can comfortably go. Turn your head, bend your neck down to your ear, look up. It doesn't help to guard your neck because your neck muscles will feel more seized up and your spine will feel locked up in the long run. Speaking of movement, exercise to stimulate blood flow to your brain. The latest research findings show that mild exercise can greatly help speed up your rate of healing. Why? Well, exercise that raises your heart rate will also raise the blood flow to your brain, and increased blood flow is crucial to take away cellular debris and inflammatory products and bring in nutrients for cellular healing. Not only that, but gentle exercise can help improve your fear, anxiety, depression, and stress that you may experience from having a concussion. Early gentle exercise can also prevent the chances of chronic pain and disability from setting in. Finally, exercise can help promote better sleep. After resting for 1 week and seeing how you feel, consider trying some gentle exercise. What's the best type of gentle exercise after concussion? Walking. As long as you are steady on your feet, walking can be the best and easiest form of exercise. Try to walk outside in a peaceful environment like a park or walking trail where the noise is minimal. It's best to walk earlier in the day so that the bright sun doesn't irritate your eyes and the heat doesn't go to your head. Otherwise, you can try walking on a treadmill or using a stationary bike. But stay away from anything that might shake your brain and neck too much, like sports, running, or jumping. Now is not the time to try riskier activities like roller coasters or trampoline parks or any other new activity that you've never tried before. If you're worried about your balance because you have bouts of dizziness, then consider getting a walking and balance assessment from physiotherapists. They will be able to assess you safely and may prescribe a walking aid and balance and dizziness exercises. In the meantime, make sure you walk with someone who can help keep you steady. After all that exercise, it's time to get restorative sleep. Our bodies repair when we sleep. Our brain performs its housekeeping duties, so to speak. Toxins are removed, memories are consolidated, emotions are processed, and hormones are released to help with growth and tissue repair, appetite regulation and digestion, and immune system management, to name a few. Take a look at our videos for tips on how to get better sleep. A couple of key tips that relate to post-concussion syndrome are to invest in a supportive pillow, try a weighted blanket to calm the nervous system, and try a white noise app or fan to distract you from the tinnitus that you might have. The most important tip for sleep is to go to bed and wake up at the same time every day, even on weekends. Your brain will learn to associate your wind-down routine with your designated bedtime and adjust your sleep, promoting hormone levels accordingly. Remember how I talked about the brain undergoing changes with repeated activity? In the same way that we typically get hungry around the same time every day, we can train ourselves to feel sleepy at the same time every night. Give your brain a break throughout the day. Before your concussion, a break might have meant scrolling through social media sites, watching TV, or listening to music. This type of brain break is a bit more intentional. It's a complete break from doing, thinking, and feeling. Is that really possible? Yes, with a lot of practice. There's that concept again. With more practice, your brain can go on autopilot. One of the best ways to get into that Zen headspace is to meditate. The majority of us find that difficult, pointless, and boring, but people who meditate regularly swear by its ability to relax, stimulate creativity, improve pain and patience, self-reflect, and start fresh. There are tons of amazing guided meditation apps and videos to get you started. Next, keep a journal. When you're feeling crummy, it feels like nothing has changed and nothing will ever change. It can really send you into a downward spiral. That's where journaling your symptom progression can come in handy. You may want to track how many hours you slept, which days you had headaches, dizziness, or nausea, times that you felt exhausted, times that you struggled with memory loss, and how many minutes you spent exercising. You can see any trends over days, weeks, and months. If you're already having memory problems, keeping a journal can be a fantastic aid. This log can also come in handy when you follow up with your doctor. Next, feed your brain good food. In general, an anti-inflammatory diet will promote better blood flow and healing. Check out our videos on how to decrease inflammation. Some key brain foods that you may want to incorporate are nuts, salmon, leafy greens, veggies and berries, and olive oil. Foods to include sweetened foods and drinks like pop. Highly processed foods like chips, pasta, and fast food, excess salt and preserved meats like hot dogs and bacon. Avoid foods that often trigger headaches like alcohol, excessive caffeine, chocolate, aged cheeses, MSG, and artificial sweeteners. Drink enough water. Should you always drink 8 glasses of water? Just drink enough so that your pee is clear and light yellow. Studies show that being dehydrated affects your brain processing, perhaps because the brain is composed of about 75% water. So transitioning back to school or work, your return to work strategy should be gradual and flexible should there be any symptom flare-ups. After your doctor's advice for your designated rest period, try to gradually resume doing the things that are required for school or work. For example, start with reading an incremental amount of screen time and take a break if you start to feel exhausted, have eye strain or pain. Gradually expose yourself to brighter lights and keep your sunglasses handy if it feels too overwhelming. Have some earplugs on hand too. Resume easier chores and errands like grocery shopping and driving short distances. Consider working half days or working more from home or delaying any major projects or exams. Continue journaling your symptoms so that you can analyze your triggers and try to up your tolerance levels little by little. Keep in mind that your energy level may not be the same too, so take more movement breaks and after meal walks to boost your energy. You may need medical clearance or special accommodations if you need to operate heavy machinery, work at heights, drive for long periods of time, work night shift, or have a job where you need to focus or require high amounts of precision work. If your symptoms get noticeably worse, pull back a bit. Go to a quiet space. Remember that your recovery may not be linear and it takes time for your brain to handle increased stimulation. Keep following up with your healthcare team to stay on track. And finally, transitioning back to play or sports. It's best to work closely with your team's coach or trainer if that's an option. Think about your history of concussions too. You should not return until all of your symptoms are gone. If you find that physical activity triggers any symptoms, then you should stop immediately. If you feel well, start with light cardio, such as 5 to 10 minutes of brisk jogging or biking. Do not start with lifting weights yet. Give yourself a minimum of 24 hours to see if there are any symptoms that flare up before moving on to the next step. Next, work on increasing your heart rate with cardio activity for longer periods of time. You may consider more vigorous activities like running and light weightlifting. Again, give yourself a minimum of 24 hours to see if you develop any symptoms. Next, get into heavier non-contact training like sprints, heavyweight training, non-contact sports drills, and jumping. If you're still feeling fine, you can get back into practices where you can also practice full contact movements. Finally, the last step involves returning to competition or tournaments. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.